Subscribe. Okay, ladies and gentlemen, we are back and our computer is back up and functional. And now we're going to be talking about the first topic of beautification of women. And we are talking about plastic surgery. And my special guest is Dr. Ravi Somayazula. Dr. Ravi Somayazula, welcome to All India Radio Houston, sir.
Thank you so much for having me today.
We are delighted to have you. And okay, let's start off by giving your little office location and your specialization, and then we'll talk about some very important topics that are of interest to women.
So thanks for having me. As mentioned, my name is Dr. Ravi Somayazula. I'm a board-certified plastic surgeon.
Yeah.
My office is right behind Methodist Sugar Land Hospital off of 59.
Yeah.
The address is 3531 Town Center Boulevard South, Suite 102. We'll be mentioning that a few times during the show.
Yes.
The majority of my practice is cosmetic plastic surgery. I do a handful of reconstructive surgery, and we'll be talking about some of the topics today involving breast reduction. And so a lot of these things are considered cosmetic, and that's the majority of what I do on a day-to-day basis.
Okay. Ladies and gentlemen, we are talking to Dr. Ravi Somayazula. Okay, let's start off by talking about what are the most common conditions that you encounter in your practice?
So the most common things that I see on a day-to-day basis are patients who are interested in enhancing the size and the volume of their breasts, so specifically patients interested in breast augmentation surgery.
Yeah.
Patients who want to optimize the contour of their abdomen, whether it's after, most of these women are, usually come to see me after they've had multiple children. So usually we talk about tummy tucks, and sometimes we talk about liposuction in conjunction with the tummy tuck to help contour the abdomen. Also, I see a lot of patients, surgical weight loss is definitely a popular and very quickly growing facet of weight loss. And some people do it through diet and exercise, and some people need surgical weight loss. And with surgical weight loss, the tendency is to lose a significant amount of weight very quickly, and that can lead to a lot of excess skin.
Yeah.
And a lot of those patients are very, very healthy after they've lost all their weight, but they're very unhappy because of all the excess skin.
That's right, yeah.
And so I see a handful of those as well on a weekly basis, with patients interested in total body contouring procedures as well. And then I would say that the next thing after that would be breast reduction. Patients who have a lot of symptoms of neck pain and back pain who are interested in reducing the size of their breasts, and it's one of the most gratifying procedures that I do for patients.
That's absolutely fascinating. Ladies and gentlemen, we are talking to Dr. Ravi Somayazula, who is a plastic surgeon. We are talking about beautification of women, and during second half of the hour, we are going to talk about women and heart disease. This entire hour is dedicated to women's health and well-being. Okay, let's start off with breast reduction. Just walk us through, from the time a patient walks in to the time they are ready to get their glamour shot and say, okay, I'm happy.
Yeah, sure. So essentially, when a patient comes in interested in breast reduction, one of the things that we typically ask them are the things that most insurance companies also want to hear about as far as getting approval. Let me step back by saying that breast reduction, although it's considered a cosmetic procedure, or at least I consider it a cosmetic procedure, it is covered by your insurance. And it's a blanket statement. There's some exceptions to that rule, but pretty much, depending upon what your insurance plan is and what your deductible is, that's typically your only out-of-pocket cost, and everything else as far as the hospital and all that is covered by your insurance. So when a patient comes in, their typical complaints are usually neck pain, back pain. Some patients, without getting too explicit, they have some, a lot of these large-breasted women, they have issues with rashes and sometimes even infections in those areas below the breast. And so typically we document all these things, and sometimes we would need also a supporting letter of documentation from their primary care doctor, who they've probably seen for some of these conditions. Sometimes at that point, we see the patient, we talk to them about these issues, we ask them what their bra size is. A lot of the times women with large breasts like that, they really don't have the proper bra size, but they pretty much buy the largest bra they think they can fit into. And then we basically take pictures before. We send the pictures and the letter of medical necessity to the insurance company. Sometimes we would ask their primary care doctor if they've seen them for issues as well to write a supporting letter. And then depending upon the insurance company, every insurance company takes different times, but typically anywhere from 2 weeks to maybe 6 weeks,
I see,
we'll hear back from the insurance company, and we hear that they're approved. And in that case, we have them come back. I go over the details of surgery, kind of where the scars are, and then basically we, if they're otherwise, we go through a thorough medical history, make sure that they're a good surgical candidate, a good medical candidate for anesthesia, and barring any one of those things, then we can go ahead and schedule them for surgery. And then typically this is it's not a painful procedure. People think surgery and it might be very, very painful. There are other surgical procedures that a lot of patients have which are much more painful than breast reduction surgery. And it's not, people feel sore for a few days, but typically by the time a week rolls around, by the time I see them back in my office, they've already felt the difference as far as the neck pain and the back pain. It's an immediate gratification. They see the difference immediately. And it's very, very well tolerated and very high patient satisfaction. So typically, it's a day procedure. You go home the same day.
I see.
And that's pretty much it.
They go home the same day?
Yeah, they can go home the same day. Some women are apprehensive about maybe the pain issues, and so once in a while we'll have some patients stay overnight. For the most part, patients can go home the same day.
So let's step back one step and. Do they need like a medical trial or something, like for obesity? You try exercise, you try to lose weight and see if that helps the symptoms?
Yes, so sometimes we'll have to get a letter of, the insurance company will require physical therapy.
I see.
In my experience, physical therapy, it's one of these loopholes that unfortunately insurance companies make you jump through. But 99.9% of the time, physical therapy will not help this condition. It just prolongs the inevitable, which is
that's right.
Needing surgery to help with this. And so I've never had anybody ever come back and say I would never do this over again, because it helps them with exercise. Some women who are obese with large breasts, one of the rate limiting steps for them to be able to exercise is the large pendulous breast situation. So once you correct that, then these patients can go on and all of a sudden they can lose weight. And I see that all the time. They'll say, "Oh, Dr. Ravi, now I can exercise." They'll lose some weight. And then believe it or not, all of a sudden now that their breasts are smaller, they can actually see their tummy. And now a lot of these patients are also interested in the tummy tuck.
That's fascinating. Sorry, I'm getting over a cold. Let's walk us through a little more about the surgery. What actually happens in the operating room? Is what kind of incisions, and how you use robotics or you use
No, so basically the surgery typically lasts about 3.5 to 4 hours. It's really just a lot of cutting and sewing. It's not like an extremely complicated procedure. It's just you have to be meticulous about your suturing and all that kind of thing. So it's a 3.5 to 4 hour procedure. We don't use any robots. We just use conventional tools that we normally use in the operating room. And then basically, we leave little drains in place. The drains, there's usually typically one drain that comes out of each breast, and that just helps the fluid come out while things are healing. And typically, we just take those drains out in the office in about a week, and it really is painless.
Is this like one incision, or is it more?
Oh, right. So the incisions, typically, one of the things that I mentioned to patients is that in order to enjoy the benefits of smaller breasts that are lifted, and in breast reduction, you don't not only reduce the size of the breast, therefore alleviating the symptoms of neck pain and back pain, but you also get a breast lift. And it's one of the things that you do by design. And so the incision, if you can imagine where it is, it's basically, if you can imagine drawing a lollipop, the circle is around your areola, and the vertical incision, the stick of the lollipop, basically comes down from the bottom of the areola down to the breast, and then basically it goes horizontally right in the fold. So the one that's the most visible is that vertical incision.
That vertical coming down from the nipple.
From the nipple.
I see.
And people always ask, okay, well, some women, you tell them about scarring and they don't care, and they don't, you have to explain it to them.
Given they got such large breasts and they're struggling with the weight, all the symptoms. The most important thing is for them from a health point of view.
Correct.
I think they want.
And there are certain things, you talk to patients, if they're still worried about what this final scar is going to look like, we tell them, say, listen, in 3 to 6 months, depending upon what the scar looks like, we can always go back in and do a surgical scar revision. And even during the healing process, there are certain silicone-based creams and silicone-based products that we can apply to the incision to facilitate the scar to look as best as it possibly can. But despite that, there's no such thing as scarless plastic surgery. Anybody that tells you that is probably, taking you for a ride.
That's what people have the imagination. If I go for plastic surgery, I shouldn't be seeing any scars, or my people who are watching me. I mean, especially if they're like in public image.
Right. The only person that heals, or the only entity that heals without a scar, is probably a salamander or fetal tissue. But once you're not a fetus anymore, you're just like the rest of us.
That's fascinating. So you told me that you operate on both breasts at the same time. It
Correct.
doesn't matter what the size is.
No, it doesn't really matter what the size is. And in fact, whether insurance covers it or not, a lot of it is based on how much I think I'm going to remove in terms of weight of breast tissue, in addition to what we call their body mass index. So for example, a body mass index takes into account their height and their weight, and with that you calculate out a number. So that number is typically given to the insurance company, and then they also want information from me about how much breast tissue we're going to take out, and they look at that to determine whether they're going to approve it or not.
Okay, here's the thing. Now, we already done the surgery, everything looks okay, they're going home the same day or the next day. Mm-hmm. How soon they can recover?
Yeah.
In other words, how soon they're able to put on their bikini and head to the beach?
Yeah. So basically, my instructions are really no heavy lifting, anything heavier than about 4 or 5 pounds for about 6 weeks. And the reason why is, for a lot of patients, that's really not a big deal because most people don't do that anyway. And a lot of it depends upon what they do for work. So if you're, for example, a manual laborer, then you might have to take some time off from work. If you have, most women, I don't want to stereotype, but a lot of women, at least in my practice and in my experience, it's something that doesn't completely disrupt their day-to-day routine. If they have little children that they have to pick up, then they have to make, due consideration for that, and they have to get some help for that. But other than that, if they've got a desk job or secretarial type of job, they can probably go back to work after about a week. Some patients even go back to work within a week. So it's really, a lot of it just depends upon what you do for work. But my instructions are no heavy lifting, anything heavier than a gallon of milk, which is about 3 to 5 pounds, for a total of 6 weeks.
So is there any instance where you can go back and remove more tissue if you have to?
Yeah. So, after about 3 to 6 months, and at the end of the day, it's a cosmetic procedure. I get a lot of women who say, they've been living with this for such a long time, they'll say, well, you can take my breast completely off. And so we'll tell them, wait, hold on, we can't do that. And it's really a cosmetic procedure. So the breast has to look proportionate to the rest of the body.
Yes.
And so, what we try to do is, during the operation, we actually remove the breast tissue and we actually sit them up in the operating room table, and I take a look at it and I use my clinical judgment to determine whether or not enough breast tissue has been removed, and if so, does it look proportional to the rest of the body. Having said that, after 3 to 6 months, if they feel like their symptoms haven't been resolved, which has never been my experience, theoretically you can go back and go back and do another reduction, either through incisions or with liposuction at that point.
That's
liposuction is a nice tool to use in order to also do a breast reduction. It can't be used for the initial large breast reduction, but just if you just want to reduce it just a little bit more and tailor it a little bit, you can always go back and do liposuction.
Well, here's my next question. Like when we remove this breast tissue and all these things, is there a chance this can grow back and there's more accumulation of fatty tissue?
Yeah, so as a woman ages, the majority of her breast tissue gets replaced by fat, fat. In a younger woman, and typically I've operated on girls who are 15 or 16 years old, and usually that's related to hormonal related changes.
I see,
And so sometimes we've had to do that. I've never had anybody come back to me after that and say, my breasts have gotten larger. But theoretically, if it starts early on, in their pubertal age, then it theoretically can come back because the hormonal influence hasn't been really changed. So you haven't really changed the underlying reason for the large pendulous breast in a young woman. So theoretically, it can come back. And some people have argued you can give anti-estrogen medication to try to block that. That's beyond the scope of what I do, but I've never had to refer it to an endocrinologist for that. I've never really ever seen recurrence, but theoretically it's possible. And also, and even in the older population, all bets are off. If you're putting on 40, 50, 60 pounds after this, then that's going to be fat tissue, that's going to be fat that's going to be deposited in your breast, and theoretically the breast can get larger again. So as long as you're not putting on significant weight, if you're older, after puberty, if you're not putting on significant weight,